The scenario here at Ingutsheni is just the same scenario with what we've seen at UBH, but the only difference is that there is low supply of these antipsychotic drugs, but since the government has allowed an institution like this one to purchase from private partners the drugs, so as you heard them that they have said by early next week they will be having improved supply of these antipsychotic drugs which are needed at this institution. So basically, but in terms of management, yes, our CMO is trying to make things happen, but although there are some saboteurs around him who are trying in fact to not maybe him to succeed or to give quality service, if I may to say, because as we have seen also is there also a mandate to produce some special irrigation stuffs, as we have seen that they are growing vegetables, maize and what have you, so that it will enhance also to in the feeding of our patients. For now they've got about 3,000 beds which they are doing, and of which they are pushing 1,000 every 2 weeks, and they are getting about $1.5, which is a lot of money, which if it's not mismanaged it can add something, especially in the drugs procurement, in the feeding of the patients. So I think they are in a good direction, but what we need also to assist them is to maybe they were having challenges. They are having challenges about with the water, especially their bores. They are not enough to do the irrigation facility, but we hope and we are going to assist them in making them avail those bores so that they do more production, so that they can also supply other institutions or sell to other institutions, so that they can capacitate their institution, their hospital. There are huge plans which are there, which are supposed to be done, because we know this is a challenge, not Zimbabwe only, but so many countries about drug and substance abuse. But as a country, we are in a now advanced stage where we want to make sure some vocational training centers that are turned into rehabilitation centers, such that these recovered patients from Ingutsheni, Komahuri and so forth, they are taken to those vocational training centers turned to be rehab centers, so that our burden from these treatment centers like Ingutsheni is lessened. But I think now it's on an advanced stage. I know the Minister of Youth with the Minister Machakaire, and also there's the chairperson of this committee which is spearheading. This is chaired by Minister of Defense, Minister Shinguri. Also, she's also involved in this. So it's a holistic approach, multi-sectoral approach, ministries to come into to fight against this challenge which we have faced by many countries, also particularly Zimbabwe. So definitely we know we are on a certain stage which people see the lesser burden on this institution, because as you know, Ingutsheni, yes, it can be a rehab center, but mostly it's there for curative. So now, yes, at one go is just doing the same business, because some of the patients, they are going to occupational health areas where they are taught how to survive without thinking of getting employment. Also how to be reintegrated with the community, so that they can do self-sustaining projects, especially these ones manual, which they can do.